Welcome to a conversation with senior executives at Healthcare Corporation of America. Today, we're joined by Dr. Tom Garthwaite, Chief of Operations for Clinical Services, and John Steele, Senior Vice President for Human Resources at HCA. I'm Ken Freeman, Allen Questrom Professor and Dean of Boston University School of Management, and thank you for joining us. Gentlemen, thank you as well for joining us this afternoon.
Pleasure to be here.
For context, HCA is the leading provider of healthcare services in the United States, accounting for roughly 5% of healthcare spending through 165 hospitals, 115 surgery centers in 20 states and in London, with more than 20 million patient encounters a year, 212,000 babies delivered a year, and a similar number of employees. As you might imagine, HCA is at the center of the transformation of healthcare. Again, welcome. Let's get acquainted here. Tom, perhaps we could start with you. Would you mind sharing your background with us and how you came to join HCA?
Well, I had kind of a long history. Started out in college at Cornell and medical school at Temple University in Philadelphia. Went into internal medicine at the Medical College of Wisconsin, followed by a fellowship in endocrinology, and was teaching medical students, doing research and giving clinical care there. And rotated and spent a lot of my time at the VA facility there, and got interested in the politics of the VA and came to a kind of a fork in the road where I could either learn molecular biology and do research at that level or take on some administrative tasks, and I did the latter. And as I got into that, I ended up serving in Washington in the Clinton administration as first the deputy, then the undersecretary for health in charge of the VA healthcare system. I went from there to run the health system of Los Angeles County, 10 million people and lots of responsibilities, including public health. Then did a 4-year stint in Philadelphia with Catholic Health East, a large not-for-profit system. And then finally saw an advertisement for a friend of mine needed a chief operating officer, John Perlin at HCA, and decided, because we were interested in moving and doing something different, to join HCA. Also knew that it was one of the largest health systems in America, and I knew from my time in the VA that large healthcare systems had huge impact, and large healthcare systems had flexibility to innovate. And I think those two things, plus my friendship with John Perlin, really led me to want to come to HCA, and glad I did.
Fantastic. Well, it sounds like a great story. And how long have you been with HCA
About
now?
4.5 years now.
About 4.5 years. Fantastic. Now, John, how about yourself? What's your story?
So my story is a little different, of course, and most of my career now has been with HCA. I've been with HCA a total of 20 years. I started my career, actually I had a degree in communications of all things, and like so many people in human resources, I sort of ended up in HR. My first job in the general space was with ADP, and I was an account executive and responsible for installing payrolls for companies all over the Detroit metropolitan area and some national companies. And I saw an ad in the paper that said, if you like people and you have a little bit of technical expertise, you should apply to this. And it was a job with EDS. And I became a technical recruiter with EDS, learned how to recruit, spent 9 years with them, and left to go into the pharmaceutical industry, where I was going to manage recruiting for Alcon Laboratories, which is a part of the Nestle organization. And 1 year into it, I decided the pharmaceutical industry was not going to be for me. Great industry, and Alcon's a great company, but their product cycles sort of determine the way they move in terms of how they deal with change. So they focus for a much longer period of time than I liked, having come from EDS, where things happen very rapidly. So I had mentioned it to a couple friends, one of whom was ran a search firm, and he introduced me to what at the time was Columbia HCA, where I came in as the head of their executive recruiting function. Perfect time for someone like me to join, because it was a little bit of chaos. There were 3 companies, large hospital companies that had come together. HCA, Galen, Health Trust, and Columbia had all sort of merged together, and each had their own process. Things were going in a lot of different directions. And so I focused on putting process in place and getting things organized, and from there I just moved up the food chain, as it were, within human resources, and in October of 2003 became the Senior VP of
How
HR.
about that? And congratulations on being named the HR Executive of the Year by
Thank
HR
you.
Executive Magazine as well. That's a tremendous
It's quite
honor.
an honor, yeah.
Yeah, we're very happy for you. And gentlemen, we think about HCA, and the track record of HCA is one where you're known for serving your constituents very well, whether it be the patients, the physicians, your employees, the communities you serve, and also, frankly, the investors. What's the secret of being able to really exercise responsible leadership across all of those various constituents? So many companies get it right maybe with one or two constituents, but not all. What do you think the secret is?
So, Tom, I'll start. Because I think it's the
Please.
leadership. It starts with leadership. And we are unique in that we were founded by two physicians and a businessman. And physicians really are hands-on, touch the patient, identify the symptoms, deal with those symptoms. And that sort of permeates the way we have operated as a company for 40 plus years now, in that we see a problem, we deal with it very individually. We're not a black and white company that says everything's going to be this way. Today it's 165 hospitals, at different times it's been 500. But we utilize that sort of hands-on touch with the community, with physicians, with employees, to drive our thinking and how we respond to things. So it never feels, even though it's a big organization, it never feels like you're overrun by this giant bureaucracy from Nashville. Even though we do leverage our size, we always, I think, come back to healthcare is a local business, and we deliver it from there. So at the core, I think what's made us successful over the long pull, and what's made us be able to deal with the changes, is that we've consistently had that right kind of leadership at the top.
Tom, do you have anything to add?
I think, as someone relatively new, I would say that I would echo that. I would say that clearly the leadership, the culture that leadership fosters, that relentless focus on doing the right thing and doing the right thing for patients. We come across things in clinical services where there might be some question as what's the right thing to do. And I have zero question that if I bring that question forward, that we'll get the answer that's right for the patient. And ultimately that, because we have so many caregivers across the organization, I think drives people to do the right thing and put the patient first.
So having the tone at the top, patient
Absolutely.
first, and an unwavering commitment
Yes.
really makes your jobs easier, I would imagine,
Right.
every day
It
too,
does.
and the role of the employees throughout the company that much clearer as well.
Absolutely.
Now, there's a 5-letter word that's permeating all of healthcare right now called Ebola, the Ebola virus. And with the 20+ million patients you serve each year and over 200,000 employees, I've got to believe that Ebola is on everyone's minds inside the company as well, and anybody who in the firm and anybody who visits one of your facilities. What's your view? What does a hospital company such as HCA need to be doing to help ensure the safety and well-being of employees, and also that patient care is well served in this instance? Tom?
Yeah, absolutely. Just a step before the current Ebola crisis, just to recognize we've had a consistent effort to decrease hospital-acquired infection,
Yes.
to immunize every one of our employees against influenza, for instance, because we think that it's intolerable that one of our employees would ever give a patient influenza. And so we've really led the industry in reducing hospital-acquired infection, immunization of employees, and so forth. Now, Ebola, we think there are probably two major areas that are of concern right now. One is for our employees, the early recognition of someone who could be carrying the virus. So we've spent a lot of time training our frontline staff, every place from registration, emergency room, doctor's offices, to immediately ask how the patient's feeling, do they have fever, and have they traveled or been exposed to anyone who has traveled to an area endemic to Ebola. So we think that's the first part, early recognition, minimize contacts if someone is highly suspicious until we can get the test done appropriately. So recognizing for the patient, of course, but also recognizing for our staff. Then if we have a highly suspicious patient, or if we have someone who tests positive for Ebola, if that were to occur, we spent an increasing amount of time on really almost overprotecting our staff from the Ebola exposure. We think it's critically important that we err, if any way, on overprotection. So getting the right personal protective equipment available in every facility, making sure we have stores of that in case there are more cases. We can get them from one facility that's not affected to one that is affected. So a lot of the planning right now is about those sort of things, the detection and early identification, minimal contact in the beginning where we contact the public, and secondly, to make sure we protect everybody the best we can should we be treating active Ebola.
And from a direct line employee standpoint, it sounds, based on your comments, Tom, that there's a lot being done to help ensure the employees are informed and have the appropriate training, equipment, and what have you.
Yeah, communication.
There's got to be an
is key,
emotional
yeah.
aspect to this. There is.
Probably the biggest challenge we have right now, Ken, is the emotional aspect of it. People are afraid. I mean, they don't know how even though they hear the CDC say this is how it's transmitted, they hear us say, you know, here are the guidelines you should follow. It's still very unnerving. There's a lot that people don't feel like they know. And so our job really is to continue to communicate, to be transparent with employees, to tell them what we know, when we know it, not try to hold information back. You know, one of the things for me that it makes us deal with these things fairly well, you know, in Katrina, we learned how to really mobilize around a disaster. And so at that time, we instituted a consistent form of a command center. And now we have command centers at the Nashville office, and in every hospital has its own command center. So we have a way to communicate information quickly and efficiently and to report back on what's going on. And I think it gives our employees a great deal of comfort to know that the organization is mobilized in that way from one end to the other.
That's interesting. So in a way, the Katrina disaster in New Orleans was essentially a test kitchen in a way for the more global impact where every single one of your hospitals now has to be prepared for what could take place vis-a-vis the Ebola virus.
And that's the big difference, of course, is just what you said, the difference between dealing with New Orleans and dealing with all 165 hospitals, surgery centers, freestanding EDs. It's a big challenge for the organization.
Tom, the electronic medical record, certainly the government's been very motivational for hospitals around the United States to invest, if you will, in the technology and the capability. HCA's been at this for quite a while now. Are you seeing the benefits that you would have anticipated by deploying the electronic medical record comprehensively across the network?
Yeah, no, I think we are beginning to see significant benefits. It's never as fast as anyone would like. Automating and putting into digital form the health record is difficult because we haven't used the right terminology and language and lexicons that you know, banking, everyone adds the same way. In healthcare, we call things a lot of different things. We're not as precise in our language. There aren't standards between hospitals and facilities. So it has been slow coming. But I think we've come a long way in that regard. We've standardized order sets. We've standardized physician documentation, nursing documentation increasingly. And at HCA, we've done something I think that's really just beginning to bear fruit, and that is created an clinical electronic data warehouse. And so that not only the billing data, which we've had for years, but all the clinical data, laboratory tests, imaging reports, vital signs, all those pieces are coming into this massive database. I don't have enough scientific knowledge or computer knowledge to tell you what a petabyte is or what the things after that are, but I can tell you that everybody's pretty impressed when they hear how much data is in there. And what we're beginning to do then is ask, how do we use that information to understand how to improve care? How do we get real-time decision support to the physicians and nurses as they care for patients so that they can be, you know, like the warning light in your dashboard tells you, you know, your oil light is low. Well, what does that in the healthcare setting? We've had some of that, mostly depend more on people and maybe a few machines. Now we're getting more sophisticated at a more granular level to understand, you know, what changes in the patient's condition should we know about and react to more quickly to avoid complications, to improve survivability, reduce morbidity, mortality. So it's a very exciting time in healthcare.
Yeah. And is the clinical data warehouse you've described, which seems to enable the provision of care beyond just being a recording device, if you will, for transactions, if you will, between a patient and their physician, is that helping to drive physician acceptance of the electronic health record as an important aspect of how they're performing their medical task?
Yeah. I think as we get them more useful information more easily and more readily, it drives it will drive satisfaction. So some doctors, I think, already feel that the electronic health record is helping them care for patients. Some feel it's probably slower than writing illegibly in the chart and getting on with their work. So, all doctors don't love to document what they're doing. Just last month, we purchased a company in your vicinity here, geographic vicinity in Waltham, Mass, called Patient Keeper. And the reason we did that is because we believe that provides a much better interaction for physician with the record. And we think by expanding what they've done, using what they've done and then expanding it, we can create a greater acceptance and more meaningful interaction of the clinician with the computer systems.
Interesting. And let's turn now to a different form of the ethical considerations in healthcare. There's so much about ethics in so many ways, the medical ethics equation, and then the more broad corporate ethical decision-making process. HCA, John, has been named to one of the world's most ethical companies by Ethisphere for about 5 years in a row. HCA didn't, in the olden days, there was a time in its history where maybe it wouldn't have been on that list.
That's right.
What is it that you've done or has been done at HCA to help ensure in such a large organization that you're viewed as being one of the real icons of ethical leadership?
Right. Ken, and you referred to a period of time that, as you said, we may not have always been thought of that way. And as we came out of that period of time, we, as an organization, we determined that, like anything we do, we were going to be the best at it. And we went out and hired an outstanding ethics and compliance leader, a gentleman named Alan Usby. And Alan brought a wealth of experience from the defense industry, some of the same processes. And what Alan did that I think made our program work so well is that he, again, very transparent about it. We shared everything we did. Our code of conduct was available online if other companies wanted to look at it. We tried to keep things in plain English. We set up an ethics line where anybody, anytime could call, and we triaged those calls back either to the functional leader team that needed to deal with it, if it was a human resources question about how an employee felt like they were being treated, or if it needed to go to the finance department. And the ethics department, ethics and compliance department, made sure that we were accountable for following through and responding to that employee. Because you can say anything you want, but if you don't follow through, if you don't deliver the goods on the other end, employees are not going to trust that it really means anything. And I think that's been the difference maker for us, is that we follow through on any complaint, whether it comes back through the ethics line or it's followed through from human resources, finance, or whomever.
So you have a clear process, clearly communicated, encouraging engagement, transparent, with a closed loop, which that's fantastic. Yeah. Ethics is a big focus now at the business school here at Boston University, School of Management, also at many other business schools around the world for lots of obvious reasons in light of the Great Recession in particular. As you think about individually about maybe ethical dilemmas you might have experienced either at HCA or somewhere else along the way, would either of you have an experience you might be willing to share about where you faced an ethical dilemma and how you went about addressing it, maybe impediments to making the right decision, and how you came to the ultimate decision in moving forward?
All right. You first, Tom, or me?
I can give one at HCA. I mean, when you come to HCA as a new employee, it's very clear that the biggest ethical breach you could make was to feel that something was unethical and not tell someone about it and try to get it fixed, because it was very clear that that was your first responsibility. We had I'm in physician credentialing is under my responsibility, and we thought that a physician had been credentialed, and that as we investigated how it happened, we thought it shouldn't have happened. We were trying to figure out how we could keep it from happening again, and we really came across that we thought someone in the lane, in the hierarchy had not been fully forthcoming with the way that the events transpired. So I had to really decide whether to go up that food chain or how to go about that. And so I went and talked to Alan Usby, and it was very clear within a very short period of time we had everybody in the food chain, several levels higher, having the discussion. It was very clear the right things got done for the employee, the right things got done for the corporation, the right things got done to protect patients. So I really felt exceptionally good about that, but I had a few nervous moments. Should I bring this up? Because many of the people we had to bring into this conversation kind of outranked me in the hierarchy of the organization. And I think you always wonder, how do you bring that forward like that?
So it was a classic example. If you see something, say something,
Right.
and you uncovered and discovered a culture that was very welcoming and
Open.
accepting
Absolutely.
of this,
Yeah.
which I would imagine then moving forward also just makes it that much easier to
Exactly.
engage in what might be called an ethical or an informed judgment kind of a way
Absolutely.
moving forward.
Yeah, over the years, of course, in human resources, you see all kinds of different challenges where it appears someone is struggling with situational ethics. And an example, and that this has happened multiple times, is where we have had a sexual harassment issue between a senior person in a hospital who is a high performer, well respected in a marketplace, has done a lot of good in other ways. And there becomes this instant struggle as a leader. Do I make the decision that I would make 9 times out of 100% of the time for an average performer, or am I going to do something different ethically and give them an opportunity that I might not give otherwise? And as a company, we have tried to stand tall on that one and say, the ethics aren't up for grabs on it. But I can tell you, I have dealt with senior leaders and talked to them and gone through that process with them where it is a challenge. There are times when you think this particular CEO could go work for a competitor and do real damage and all these other issues that come to play and really begin to tear at the fabric of what the right answer is. And to our credit, I think we have found our way back every time, but not without some serious
A lot of angst sometimes
some
and
serious angst,
reluctance, but that key discussion about what the right thing to do is and to take the risk of potential damage later on is truly the high road to moving forward. In HCA, responsible leadership is so prevalent. We talked earlier about the balance where the companies discovered that sweet spot, maybe not discovered, but established that sweet spot of serving all constituencies well or striving to do so. And to drive that, obviously, metrics have to be a part of this. We measure what we do what we measure. In lots of companies, there are what we would call the steel beam, the iron rod metrics that, thou shalt achieve these metrics appropriately. Sure. And then there's some that might be called the overcooked spaghetti noodle, where it's a little bit limp in execution, where it's a metric, but it maybe just isn't held to the same standard. As you think about your responsibilities and how the company operates, what are those steel beams? What are those steel beam families of metrics that really are inviolate as the company moves forward?
Well, on the people side of the equation, certainly our employee engagement scores, how we think about it's one of the most significant measures we get back in terms of employee health. And so we put a lot of emphasis, a lot of focus on that year in, year out to make sure that across the organization, at the department level, at the facility level, at the division, group, et cetera, that if we're not doing well, we know what's going on, or we have a way of investigating and finding out what the issues are so that we can correct those. So I would say from an HR standpoint, certainly that's one. Turnover is another one. Certainly that sort of is an indication of health from an organizational standpoint. So those are sort of.
And these are metrics, as you look at the folks that are the CEOs of the various hospitals, are they compensated in part based on employee
They are compensated in part on engagement, and at different points in time we've had turnover in their incentive plan as well.
So you've got financial metrics for sure. You've got employee metrics.
Right.
And how about, let's not forget the patient. I mean, is the patient one of those steel beams, or are they one of those overcooked noodles?
No, absolutely. I think we have an enormous number of clinical metrics. There are clinical metrics that are mandated if you participate in Medicare and Medicaid, which all hospitals do. And HCA does very well on those. We really have leading performance in the mandatory clinical metrics, which we call core measures. But we have many other measures. And one of the things we've spent a considerable time on the last 3 years is what we call clinical excellence. So if you look at many measures in healthcare, there's variability. Now some variability makes sense because I would treat you differently than John or myself, perhaps because we're genetically different, maybe different ages, maybe have different conditions. So there's some variation that's totally acceptable and desired. On the other hand, if you have appendicitis, we expect to take your appendix out, for everybody, before it breaks, right, before it bursts. So that would be a metric which we wouldn't expect variability in. And so we began to look at where do we have variation that's unintended, and then how do we fix that? traditionally hospitals that don't employ physicians are a little hesitant to question the care of the physicians because the physicians voluntarily bring their patients into the hospital, and the hospitals need patients to operate successfully. But what we found was if we go to the physicians and say, you know, increasingly your performance is being posted on the internet. So are you interested in knowing your performance and your variability before it's on the internet, or do you want to wait until it affects your pay and you know, your reputation? And they all really basically said we're interested in knowing. We haven't gotten that much feedback. So we've developed systems now to look for variation in how care is delivered, and then discuss and work with physicians to understand why there's variability and then to decrease it. And I think we're being, you know, quite successful with that. We're looking at things such as when do you get extubated after you have a surgery? When do you take the tubes out? We look at the blood usage. Are you using the criteria for blood usage that are prevalent today or a few years ago? Because things have changed quite a bit. So we're looking at how soon can we diagnose sepsis and get appropriate treatment. So we're having many conversations. They're very clinical. They're very important for patient outcomes. And they involve both our physicians, and we think it's a positive. We see more physicians engaging with us, as well as our nursing staff and pharmacists and other clinical staff.
And the operating side. So if I was a hospital CEO, I'm measured on financial performance, I'm measured on employee engagement.
Right.
I'm also measured, in part, from a compensation standpoint, on those clinical outcomes.
You are.
So having that linkage across the metrics, it would seem, would be an important part of the formula for success that has really been driven so well.
For many of the clinical metrics, and reducing the variability also makes for more efficiency, avoidance of complications, which are expensive.
Yes.
And so overall, it's driven our expenses down in many areas, as well as improved outcomes for patients.
Everybody wins.
Everyone wins.
Final question, brief response from each. Let's start with you, Tom. Any final words of wisdom for students as they're contemplating perhaps having a career in healthcare?
Yeah, I think it's a great field to have a career in. There's, you know, it's if you talk to some doctors and some people in healthcare, the rapidity of change, all the things affecting it, from IT to how it's paid for, to things like Ebola and other things that make it feel threatening. Yes, there is a lot going on, but there's nothing more rewarding than to help someone through their illness. There's nothing more rewarding to help to meet the families that, as the patients do better, to provide for them in their time of greatest need. So I think it's been amazingly rewarding to me in both in administrative areas that I've been in, but also in the front line. So absolutely. Wow. And you can do almost anything in healthcare, from reading images to programming and using computers to surgery.
The opportunity to make a difference, to make other people's lives better.
Yes, you can.
John?
I think, Tom, you said it very well. I usually say to people, you know, the great thing about being in healthcare is it's a bit of a calling, that because you're going to have this opportunity to impact human life, and within HCA, there is no better or bigger platform to do it. So when we think about healthcare opportunities within HCA, and it's not just the jobs even that Tom mentioned. There are folks who get to run hospitals. You know, there are all kinds of different ways that there are corporate office positions. There are all kinds of different ways that people can do it. The one piece of advice, though, I'd throw in on top, and just in terms of how people think about their careers and success in careers at all anymore, is that we're seeing the ability to collaborate has moved to the front and center of what we need in new employees, whether it's at HCA, I think, or anywhere. The ability to work across big organizations, small organizations, multiple organizations, that skill set is becoming rare, and we need more of it.
People that can listen, engage, assimilate, and work together effectively.
Exactly. That's
as a team.
Absolutely.
We've been in conversation with Dr. Tom Garthwaite and John Steele, senior executives at HCA, Healthcare Corporation of America. Thank you for joining us, and gentlemen, thank you for your words of inspiration.